Hello, my name is Tobias and I am part of Team TuCAN. TuCAN stands for Tübingen Cognitive Assessment for Neuropsychiatric Disorders. And we want to revolutionize the screening of neurodegenerative diseases such as Alzheimer's or Parkinson. So let's get started. Currently, the screening of those diseases are conducted on paper and pencil tests like the one you see on the left. The patients have to carry out all those tasks and the results are digitalized manually afterwards. The shown Montreal Cognitive Assessment Test, or MoCA, is the one which is used most frequently. But what's the problem with those screenings? Due to demographic change, our quickly aging society is challenged by an increasing number of people who are suffering from neuropsychiatric disorders. To sustain people's quality of life, an early and differential diagnosis is necessary. But the currently used paper and pencil tests have a low reliability to detect disorders at an early or even preclinical stage. Moreover, they are extremely time-consuming and very cost-intensive. However, we have a solution for that. We are developing a screening tool that uses tablets and digital pens. Those are able to record parameters that are relevant for early and differential diagnosis. Those additional parameters are, for example, the sequences of movement, the processing times, and the pen pressure. And this data has been shown to reliably differentiate between mild cognitive impairments and healthy adults. To make clear that this really works, please take a look at the photo. The task was to draw a clock 11:10. So what would you say? The result is correct and the patient is healthy. But I have to say that this is actually not the truth. We already know, due to other tests, that the patient has a mild cognitive impairment. But those other tests are normally not done initially. So how could we find out that the patient is mild cognitive impaired? Well, in this video, you can see exactly how the clock was drawn in real time. Additionally, you can see the patient's in-ear movements as red lines. We will not watch the whole video, simply because the interesting point is that it takes so long. But I really want to point out that the process of drawing is the most important part, not the final result. By using our app, we are able to observe the much longer time in air, which strongly indicates that the patient is cognitive impaired. Our app saves time and money by collecting and evaluating all data automatically. Also, we are providing more accurate differentiation, more accurate identification, and even earlier detection. All those gains should help our customers to get their job done better. Those customers are on the one hand side, neurologic, psychiatric and geriatric departments of clinics and hospitals, and on the other hand, the family doctors and the pharmacy companies. We would only sell them a software license, which has to be paid monthly or per use. But now you may ask, what do the competitors do? Well, they just use the tablet as a fancy paper. They do not gather additional data provided by the digital pens at all. And as you have already heard, we are gathering this data, and therefore our test results are more accurate. But does the effort pay off? Let's look on the market size. We have 1.9 million people who are suffering from dementia in Germany right now, and there are 300,000 new cases each year. Worldwide, 42 million people are suffering from dementia, with a yearly incidence estimated around 2.1 million. And you have to consider that on any positive tested person, there are multiple persons who are tested negative. And those are not included in this shown statistics at all. Even they make up the biggest part of our market size. Our history. In 2017, we started with the development of our prototype. Since then, we published and presented our project at well-known conferences, such as the Mobile HCI in Barcelona, where we won the first post award. In 2018, TuCAN is supported by the Medical Innovations Incubator GmbH, and we will be funded by the Federal Ministry of Education and Research with 400,000 euros in the following month. In addition, we are preparing the filing of a patent, and we will collect data at a clinical trial with more than 900 participants. Finally, I want you to show who is standing behind this project. First, we have Heiko and Christian. they initiated the project. Then we have Franz as our business coordinator, and I myself mainly developed the prototype we currently use, and I'm responsible for the economic tasks of the startup school. So, if you're interested to support us in our project, we are looking for business partners, investors, and mentors that help us to get our project further. So let's make the TuCAN fly. Thank you very much.